All right, what's going on, guys? Today we're gonna talk about biceps tendonitis. Now, anytime you're given a diagnosis of tendonitis, there's this inherent aversion to loading that specific tendon. But the one thing you wanna consider is tendons respond very well to loading in a rehab setting. Now, a lot of guys that suffer from biceps tendonitis are more so towards powerlifters or strongman or overhead athletes because that role of the bicep is being used not as a flexor of the elbow, but more of a humeral head depressor. So that long head of the bicep tendon actually allows that decreased approximation of that glenohumeral joint. So something that's really active as a stabilizer during heavy bench presses, for example. So where you're not so much worried about flexion and extension of the elbow as you are stabilizing that glenohumeral joint. So one exercise I want you to start throwing in if you're experiencing symptoms of bicep tendonitis is gonna look like this. So when training any muscle for stability, we need to consider that a progression is never of weight first. It's always of perceived stability of that joint in the plane in which we're training it. So what I mean by this is when we do bicep curls, we do it usually neutral shoulder, right? Slight elbow flexion, supination of the wrist, flexion of the elbow. But when we're using it as a stabilizer, when we bench, we're in a more unstable shoulder position. So stability of the shoulder is directly correlated to how much abduction, flexion, and external rotation we're in. So if we're here, this is a very neutral shoulder, but that stability decreases as we abduct, as we externally rotate, and we come to full 180 degrees of the full overhead position. So we want to consider that when training the biceps to act as a stabilizer. So what it's going to look like, and this will look really familiar, a lot of bodybuilders have been doing this exercises for ages. What you want to do is get that elbow high. We're getting that shoulder past 90 degrees. So there's a moment of instability that happens when that elbow kind of crosses that plane of the body. So we're going to start out here, and then we'll just go through elbow flexion, supination. So we keep that elbow high and curl up. Now, one thing I want you to avoid is avoid training this in extension of the shoulder. So what I mean by that, when you're in this curl position, don't extend the elbow back past the plane of the scapula. Keep that in line with the plane of the scapula. So flex from here, not from here. So when your elbow's in line with the body, that's a relative extension of the joint itself. So make sure that elbow stays kind of in scaption or the shoulder stays in scaption, and then curl from there. So give this a shot next time you're experiencing symptoms of biceps tendonitis.